I'm Dr. Parvinder Shergill, and I'm going to talk about Children's Mental Health Week, which is the 1st to 7th of February. During these uncertain times, children and their parents have very much been affected. How can we help children express themselves? There are a number of things that we can do. One is picking up on children's cues. So they might not be able to verbalise exactly how they're thinking and feeling. Therefore, they might show you in their behaviour and their habits. So it's important to respond and pick up on these cues warmly by warm eye contact, warm facial expressions and open body language so they feel comfortable, and also listening and speaking back with them in a positive tone. It might be also worthwhile to talk about your own feelings with children in simple language they can understand. For example, I'm feeling sad today because I can't see grandma, or I'm feeling happy because daddy's coming home. Therefore, they will see you as a role model and that it's okay to talk about their feelings. If your child is suffering with anger, it might be a very good idea to show that they can express their anger in a safe space with recreational activities such as boxing or exercise, painting or drawing at home that you could easily do together. Having a routine is really important for children. So even though they, for instance, might not be able to see their friends or go to school, but that they still get up at a certain time, meal times at a certain time, bath time, bedtime, so they feel secure and have stability. You can also incorporate family activities that you do together on a daily basis, such as all going for a family walk to get some fresh air. What kind of things can you do for yourself as a parent? There are a number of tips for your well-being and mental health. For example, having 5 minutes every day for yourself, whether it's drinking your favourite coffee alone in the kitchen, or doing some meditation, having a bubble bath, or stepping outside for fresh air. Fresh air is very important, and trying to incorporate exercise as well. It takes away you outside of your house, so you have a different scenic route, and it's really good for your mental health and mindset as well. It's also important to really manage your expectations. If you're really struggling to try and be looking after your children as well as working from home, it might be important to try and ask for some support. So if there's someone else in the home, whether they could look after the children for the first 2 hours, for example, and then you swap. You could also talk to your employer about whether you could adjust flexible hours of working. So for instance, adjusting your times where you could work in the evening so you could spend the day with the children trying to help them. It's also important that you try and reach out to your own friends and family for yourself. So incorporating social methods such as virtual dinners that you could have around the table with your friends and family, and incorporating times in the week where you can call each other. Therefore, trying to keep a normality in these uncertain times. It's also important for yourself to have a routine. For instance, getting up, showering, changing out of your pajamas. Therefore, you get in the mindset of the day and have goals and purpose for the day, even if you'll be working from home. Thank you so much for listening, and I hope you have a very safe and happy Children's Mental Health Week.